Namo Buddhaya, salam kebajikan. Good morning for all participants in Indonesia, and good afternoon for our honorable speaker, Mr. Sten Westgard. First of all, let us praise our Almighty God, who has been giving us the mercies and blessings so that we can gather in the opening event of expert lecture by Sten Westgard Session 1, Tuesday, March 15, 2022. I would like to welcome Mr. Sten Westgard, who could attend and be the speaker for this event, and also to all the participants, the residents, and doctors of clinical pathology who have attended this event today. As we know, quality control is one of the most important things in the implementation of valid and reliable laboratory results. And Six Sigma is one of the most popular quality management system tools employed for process improvement. So the purpose of this webinar is to improve our knowledge related to quality control in the laboratory field that later can be implemented in daily activities in our laboratories, especially in clinical pathology laboratory Sangla Hospital Denpasar as the main teaching hospital of Faculty of Medicine Udayana University. Now I would like to end my speech by expressing my sincere wishes for the success of the webinar. Hopefully you will enjoy the webinar and improve our laboratory quality management. Thank you for your attention, and Dr. Mita, please proceed the webinar.
Thank you, Dr. Seni Herawati, Clinical Pathologist Consultant. Without further ado, I would like to invite Dr. Pandey Putu Ayu Patria Dewi, Clinical Pathologist, as moderator in this event. To Dr. Pandey Putu Ayu Patria Dewi, Clinical Pathologist, you have our full attention.
Thank you, Dr. Mita, as a master ceremony. Thank you for having me as a moderator in this lecture. In this lecture, Mr. Sten Westgard will give two lectures. There is a Westgard multi-role implementation and basic Sigma quality control. And for the audience, if you have a question, you can put your question in chat column or raise your hand. To Mr. Sten Westgard, time is yours, and your time is 40 minutes. Thank you, Mr. Sten Westgard.
Thank you for the kind introduction. I'm very happy to be with you virtually. Allow me now to share my screen so we can start. The topic today it starts with the Westgard multi-rule implementation, and this is a QC technique that is now more than 40 years old. Last year was the 40th birthday of the Westgard rules, and this month would be the 41st birthday. So the Westgard rules have been around a long time, but that does not mean they haven't changed. There are actually now different generations of Westgard rules, and that's part of what I'm going to explain to you. And that's the first part. And then in the second part, we'll start talking about Six Sigma. And Six Sigma represents another sort of new generation of quality control, a new way to think about and design and implement and interpret your QC results. So the goals for the first part of this lecture is we want to go through what the Westgard rules are, make sure you understand them, how they work, and then we're going to contrast them with a lot of the bad habits we see in QC around the world. And specifically, we'll be able to look at China and Asia, and we have a global survey, we have a US survey, and then we have a survey of QC practices closer to your part of the world, and we can see what things are happening that are better where you are than maybe here in the US? And where are there areas where you can still make improvements to come up to a type of global standard? Now let's talk about Six Sigma quality control, because that's the next generation of QC. You can start with 2SD is the original generation, and then you've got Westgard rules in 1981, that's the next generation, and then the modern Westgard rules are the generation after that. Now let's talk about Six Sigma and how that creates another evolution, another generation that's more advanced on how we do QC. So we're going to talk about Six Sigma, and we're going to learn how the difference in a Sigma metric will change how much QC you have to do.
There is we can do the question and answer. Yes, there is one question from Dr. Dewa Cahyadi. He asked, in the algorithm of Westgard rule, the first thing to check is 1 until 2s. My question is, if there is no 1 and 2s in my contour graph, there is a 4 until 1s or 10 times, should it be ignored or not? Thank you.
That's a great question. It really goes to the heart of the presentation. So we're not waiting for a 1-2S warning to go off. We can tell our QC program, check the 4-1S rule on every data point. Check the 10x rule on every data point. So if we can set that in our software, if it goes off, that's an error we have to deal with. It's a rejection rule. So if the 4-1S goes off, and even though there hasn't been a 2S outlier, we treat it as a rejection. Now, the deeper question is, do we need the 4-1S? Do we need the 10x rule? And if we know the sigma metric of the test, we can answer that question. We have a Six Sigma method. We don't need the 4-1S rule. We don't need the 10x rule. So if a set of data would have triggered a 4-1S rule or would have triggered a 10x rule, our system would be set up to say that exists, but it is not relevant. A 4-1S violation on a Six Sigma method is not large enough to create any clinically important error. Statistically, the error exists, but it's not clinically relevant because the assay is so good, even that small shift isn't going to change how the clinician makes a diagnosis, isn't going to have any meaningful change on how a patient is treated.
So we can use the Six Sigma, Mr. Stan, yes. Okay, there is no question again, Mr. Sten Westgard. Thank you for your very, very great lecture, and we hope we can apply the Westgard multi-rule and the Six Sigma, especially because the Six Sigma is very powerful for the quality control in our laboratory especially. And thank you for your attention. Maybe I will give the event back to the Master Ceremony, Dr. Mita. Thank you very much, Mr. Sten Westgard, for your very, very great lecture. Thank you.
Okay, so thank you, Dr. Pandeputu Ayu Patra Dewi, clinical pathologist, as the moderator. And we would like to extend our appreciation and thanks to Mr. Sten Westgard for the outstanding explanation and the lively discussion. So we are all able to attain a lot of meaningful knowledge for us to apply in our daily lives. We also would like to remind all of you that the second session of this expert lecture will be held on the 29th of March 2022, and the topic will be implementing Six Sigma statistical QC management and total quality management or basic quality management system. Before we close our event this afternoon, please allow us to take a documentation. We would like to kindly request for all of attendees to open their WebEx camera. On 3, admin will take a screenshot on our current screen.